Okay, so we are using Zoom. Today I'm going to go over some housekeeping items. All attendees' microphones will be muted during the presentation. If you're having any trouble with the audio, you can check your settings under audio settings. You use the Q&A section to ask any questions to the presenters, and me as the moderator will notify them of the questions. So you see right there that you can type in, send the question, and then either the presenter will answer that audibly, or they will go ahead and we can type into the answer there. There's also a chat function, so if you want to use that to interact with other attendees, that would be fine. And then lastly, there is a hand raising feature if you feel that you need to be immediately addressed. You can use that, but we ask that you use the chat and then the Q&A for questions during the presentation. This event is being live streamed and recorded. It will be available shortly after the event through the Rural Prep's YouTube site and embedded on our webpage. We ask that you take part in the end survey for feedback of this webinar, and there will be an opportunity to click on the link within the chat window at the end of the session, or alternatively, you will also be emailed a link within 24 hours of the event. That's all for me, so we'll go ahead and get started.
All right, well, welcome everybody. Good morning or good afternoon, wherever you are. I'm Davis Patterson, and I'm the Director of Rural Prep. I'm at the University of Washington Department of Family Medicine, and we're really excited to present this webinar on micro-research for rural health. And we had over 100 people registering, and I'm hoping that those who aren't here now will be able to view it later, as Larry said. And presenting along with me will be Randy Longnecker from the Ohio University Heritage College of Osteopathic Medicine, and Dave Schmidt from the University of North Dakota School of Medicine and Health Sciences. And let's see here. Okay, so just a little bit about Rural Prep to get us started. That stands for the Collaborative for Rural Primary Care Research, Education, and Practice. And this is a collaborative project between our three institutions and other partners. And we are funded by HRSA, the Bureau of Health Workforce, and the Division of Medicine and Dentistry. And it's a 5-year project, and we're just beginning year 2, and we are receiving about $750,000 a year in funding. And our mission is to improve and sustain rural health through community engagement and research in primary care health professions education. And when I say primary care, we mean nurse practitioners, physicians, physician assistants, and other members of the primary care team. Aims are first to conduct research. We conduct 2 projects per year of our own, and then to develop a community of practice in rural primary care health professions, education, and research. And then thirdly, to disseminate evidence, both generated from our own research, and we also aim to be a portal for evidence-based practices and tools wherever we run across them. So this is the very first of our professional development webinars, and we are open to all learners, faculty, students, residents, anybody that finds these useful, up to our capacity. But we will always be sharing these afterward through our recorded links on our website. And we'll be doing these 4 times a year, so stay tuned. At the end of our presentation, Dave will be giving you more information on our upcoming webinars, the schedule for those. So today I'm going to spend a little time talking about the background or the history of micro-research. Comes from Canada and Africa. And then Randy is going to describe micro-research in rural U.S. healthcare, give some examples. And then finally, Dave is going to wrap up by talking about our own rural prep micro-research awards that we're hoping to make in the coming years, this year and coming years. So first of all, what is micro-research? This part of our work really addresses all three of our main aims: conducting research on rural primary care education and training, engaging a community of practice focused on inquiry into rural primary care and population health, and sharing evidence to improve rural health. And micro-research began as a partnership between Canada and Africa. And this is a snapshot of that project's website and a link to it. And the founders are from Dalhousie University in Nova Scotia and Mabarara University of Science and Technology in Uganda. And I'm not sure if I've got the pronunciation of that correct, but I hope so. And their inspiration was microfinance, which probably most of us have heard of. And this is a way of providing small seed microloans to poor people in developing countries for economic development. And so their mission, the Canadian African mission, is to improve healthcare outcomes with innovative community-based research that assures quality and integration of research into the fabric of the local health system and the community. And the principles are fairly simple. It's, first of all, to improve local research capacity, and to do that by using small, locally driven, multidisciplinary health research teams to answer deceptively simple but important healthcare questions, and by doing all of that to improve health outcomes. Now, micro-research in Africa leverages seed money to provide critical fuel for small projects. And they offer up to $2,000 Canadian for these projects. And the participants receive training and mentoring, and the investigators engage in experiential and collaborative learning. And the parallel here with microfinance is micro-research helps to lower the transaction costs. So in microfinance, it's, big banks have difficulty making small loans, and micro-research tries to address that. And then to spread the risk, increasing the tolerance for risk through these small projects. And there are now many different projects in several countries in Africa. So it's gone beyond Uganda, including this one, which I wanted to highlight here, which now integrates it into primary care training in Africa at Kabarak University in Kenya. And this is a report from the Canadian Microresearch website on how it works. But essentially what they do is they're focused on, in this project, developing research and leadership skills of senior family medicine residents. And those residents lead small micro-research teams with the assistance of nursing and allied health professionals. And then they develop a research question on community health and a proposal that's relevant to their affiliated hospital site. And then the micro-research grant review team program team reviews the proposal, and those grants in this case are just $500, and that's funded by the university and the affiliated teaching hospital. And then each team has a coach from the hospital, and the residents develop their full project thesis. So that's just one example of how it works in Africa. And here are some examples of recent projects and publications in micro-research in Africa in different locations. Maternal and child health is a big focus, but if you'll notice too, the health workforce has been a focus of some of these projects. So you've got the first one there, contribution to mother's health by village health team promotion practices. So it's looking at what the health workforce is doing there for maternal health. And then some other examples, there's public and population health. You've got infant immunization, HIV counseling and testing, supporting research leadership in Africa, very much in line with what we're trying to do. And then finally, this last one on this slide, which is looking at income generating activities in motivating and retaining village health teams. And so there's a project focused on recruitment and retention of the rural health workforce, and very relevant to our purposes. So people are grappling with the same problems everywhere, which is why we think this approach might be valuable here in the US. So now I'm going to turn it over to Randy to describe some examples from the US.
So my task is to try to make this relevant to the United States. How might this work in our setting? Micro research is a bit of a relative term, and we struggled a bit with figuring out exactly how we might do this. But let me take you through several examples. Larry, can you advance? I don't somehow. Oh, there we go. I've taken what Davis just went through in a very nice way of summarizing the African work. I've tried to translate it to our setting, and I've used these 5 characteristics to describe what it is we're trying to do. We're trying to solicit locally generated and implemented projects that are in rural places and come from them and not from us as rural prep or from any university. These should be research projects in pursuit of local solutions to a local problem in small, in our case, rural places. In Africa, they use this in urban as well as rural. And with a small amount of funding, hopefully lead to a big impact. And I chose 2 examples to show you how this might work. Could you go back a couple slides, please? There you go. So this is from 15 years ago, and like many family physicians that I know, I went into family medicine thinking that I didn't really want to do research. But it only took a small amount of funding and a small amount of mentoring for me to reignite my interest in research and scholarly activity. And so in a sense, I was able to benefit from micro research. Next slide, please. Next slide. So I was interested in exploring the relationship between the Ohio State University hospitals, the College of Medicine, and our own local hospital, a rural hospital in Logan County, Ohio, because it was a relationship that had been sustained over 30 years. And I was in the process of implementing a rural training track residency. And from the very beginning, I experienced some difficulty in sustaining the program. And so I wanted to know how it was that these other relationships had been sustained. So it was a very personal and local focus. It was rural in a small place, and I used a research strategy that was adapted to small numbers. That is qualitative research. I did structured interviews with a series of key informants, transcribed those interviews, and then identified shared, contrasting, unique values and themes. So in that sense, it was locally generated and implemented in pursuit of a local solution and using methods adapted to small rural places. Next slide. Here were the questions that I had. Why has this relationship survived? What are the factors that sustained it? Who are the people that were instrumental? Were there defining moments? And these are the questions that I ask of my key informants, each of whose interviews lasted about 30 minutes. Next slide. So what did I use my money for? I actually was given about $800. And in those days, it was a little simpler. It was more like Microresearch in that I didn't have to write a 25-page grant proposal to some big place where they considered it for 6 months and then finally let me know. It was really more a matter of calling up our foundation and saying, hey, could I have $800 to buy this digital recorder and some software, qualitative software? And that's what happened. So my time was not paid for, and I had no research assistant. I did, with this money, also purchase some transcription services from our office staff. Next slide. And lo and behold, big impact. Well, actually, I'll leave you to be the judge of that. But I was able to get this published. It was my first ever published research in a peer-reviewed journal, in the Journal of Higher Education Outreach and Engagement, and really got me interested in doing more. Folks knowing that the program I directed closed may think that the research wasn't all that helpful because I never did figure out how to sustain the residency program and our relationship with the medical center. But I will argue that these principles that I learned, in fact, helped me to last as long as I did. The residency program did not close for another 10 years when it had every financial reason to do that. The main reason these relationships were continued over that time is that they were personal relationships. And so rather than thinking of the relationships between institutions being an impersonal conceptual thing, it really is made up of multiple strands of a web of personal relationships. Our residency did close because we had been capped by the Balanced Budget Act of 1996 at 1.39 residents for a 6-resident program. But in spite of that lack of financing, we were able to persist for another 10 years. And in fact, the relationships that were initiated during that time have continued to serve our community well, have continued to serve rural health well, and certainly prepared me to apply these same principles in practice in my current job as an assistant dean. So it laid a strong foundation, and I would have to argue had a big impact. Next slide. So speed forward 10 years, 15 years, now as an assistant dean for rural and underserved programs at Ohio University, we decided to give small grants to students to do scholarly work. And here was a medical student who came to me and asked, is this scholarly work? I'd like to figure out how a soccer program for middle school girls might impact their self-esteem. And so she had a local problem in search of a local solution. And the folks in Trimble Elementary in Gloucester, Ohio, were very interested in participating in this. She worked with a mentor, our director of research and education, Dr. Sharon Casapula, and was able to do a small study. Now, the self-esteem index is a relatively simple index to administer at the beginning and at the end of their soccer season. And she was able to show some improvement, although being a small number, it was hard to make a quantitative statement. So she was approaching something in a scholarly way, and hopefully having a big impact. Next slide. I'll have to leave this to the community to decide, but this picture sort of captures for me what it was that she did. I mean, here are kids of all different sizes, as they are in middle school, of all different self-esteem to start with, who can be seen here cheering at their final soccer game at what a good job they've done. And that little kid in the middle, whose face you can see, is the one who scored their winning goal. Next slide. The student really had a wonderful experience with this, got a taste of research, how much fun it can be. And although she struggled with the IRB and all of the other bureaucratic process that you need to go through to get the right to publish your research, I'm pretty sure that as an obstetrician gynecologist, and she just matched into an OB residency in Ohio, that she will almost certainly carry this forward in her practice and in approaching her practice in a scholarly way. Next slide. She did get to present her research nationally at the National Rural Health Association meeting. I caught her here talking with one of the attendees. I missed the shot where she described her project to Dr. Wynne Jones from England, the chair of Rural Wonka. So who knows where her results may go or how they might be applied in other places. We certainly have anecdotal evidence. And I do know that it changed this medical student's world, her view of rural communities, her view of research, and her vision for future work as an obstetrician in a rural practice. Next slide. And I also know that it had a big impact on me, advising and mentoring first residents as a program director of a rural training track, and now students in scholarly activity has certainly changed my own view of the world and my interest in research, and probably had something to do with my being the associate director of rural prep. Next slide. As my director of education research says, except for the funding, there's little micro about this. It did require a lot of effort. It was challenging. Perhaps it involved a little micromanagement, but in the end, a small amount of money did go a long way. And I think the point I'd like to make with these examples, next slide, please, is not only how it can be done, but that the process in micro-research is as important as the amount of funding. You know, as a parallel to microfinance, what we want to do is to accomplish scholarly work in our trainees in a way that minimizes the transaction costs. So one of the challenges, for example, that we have with a university grants management system is trying to negotiate that with as little administrative cost as possible. If it costs $4,000 to administer a $4,000 grant, that's really not very efficient. So we're trying to, in the way we structure this, to lower our administrative costs to the bare minimum, and lower risk. Again, universities, my own university, as well as the University of Washington, are very risk averse. They're very reluctant, for example, to give money to a student researcher in Alabama to do a project. And we want to try to structure this in such a way that we can lower that risk for us. And we can do that through relationships with folks like you. And so with that, I'll turn it over to Dave Schmitz to talk about our proposal.
Well, thank you, Randy, and thanks for the opportunity to work with Rural Prep and with all of you regarding, I think, scoring the winning goal along these times. And along those lines, I really appreciate that analogy. When we look at the Rural Prep Micro-Research proposal. This proposal is still pending final design with input today. We'll have a question and answer session here in just a few minutes and subsequent HRSA approval. But we are hoping to launch the application process actually this September with awards notification in October. In future years, it'll more so follow an academic calendar, so be in the summertime with regard to both application process and awarding. We'll also want to announce to the webinar registrants and those of you on the mailing list by email, so you can be watching for those in your inbox with regard to the application process and subsequent opportunities for awards. The application information will be posted to the website. That'll be our communication hub at ruralprep.org. Next slide. So the eligibility criteria, there are really 3 eligibility criteria to be met for a successful applicant. The first is who? That would be current undergraduate or graduate students in a health professions school, or also could be included as a resident in a rural residency program, so a medical resident in that case. Also, you'll need to have a research topic that is geared toward rural primary health care or rural population health, and also considering research topics that are focused on rural health workforce education and training. So a broad group of areas to be able to have micro-research topics within. And then the third criteria to be included in the eligibility is to have a designated research mentor, and I'll talk more about that. But this might be identified by the micro-research applicant, or also by the assistance of Rural Prep in matching our mentors and our applicants. Next slide. There will be some preference given to projects that are community engaged, so where the community is not only or might be the subject of the micro-research activity, but is really a participant with regard to being engaged in the process and the value that the micro-research project can bring both to the participants and to that community itself. Also, collaborative across health professions or institutions is a key aspect of looking at some of these projects in micro-research, especially in rural environments. So very key with regard to the opportunity to work across the health professions or with institutions that are working together across different geographic environments. Additionally, those applications that are associated with matching funds or in-kind contributions are particularly valuable to really expedite the micro-research investment of a small amount of funds. And so again, whether that comes from the institution or the community, it really is a way of multiplying the power and the factor of the micro-research financial investment, as well as our time and effort in each of these. What about funding? There will be anticipated to be up to $4,000 per recipient per grant year. Again, typically July through June. This year, looking at applications in September and awards in October as proposed. And the reimbursement is for qualified expenses. So examples might be research-related supplies or travel expenses related to the research itself. Note that the time spent in the micro-research activity is not associated with reimbursable funding, so not involved would be, for example, a partial FTE. That would not be one of the potential reimbursable portions of your budget. But the total funding available for all awards is expected to be up to $30,000 annually. And then there will be an additional $1,000 for travel support per person who might be presenting, working with Rural Prep to identify regional or national conferences and meetings, which are able to really disseminate the research findings, again, which can be such a valuable part, not only for participants, but also with regard to the footprint of this work, inspiring further research, and also really having an impact factor, I think, that helps to support the goals of Rural Prep. Next slide, please. So we're also calling for research mentors, and you heard a little bit about Randy's experience with that. We will be inviting people to participate not only as applicants, but also considering participating as a mentor to micro-research teams. You can see that, again, will be posted on ruralprep.org, again, sort of the hub to disseminate this information. And then the recipient and mentor will be required to complete pre-work and participate in quarterly Rural Prep micro-research learning community rounds. And that'll be devoted specifically to looking at, again, mentoring, development, also project sharing between the teams. What can we learn from each other through that feedback, problem solving? Because again, working with limited resources not only can present certainly some degree of challenges that we're trying to augment success here, but also really probably continuing to look at best practices for sustaining this sort of activity going forward. Next slide. And so what are the next steps? First, I want to say thank you for allowing us to share this current proposal. We're going to, in just a few moments, welcome your feedback today. That's important as we initiate our professional development webinars, talking in this case about micro-research. But we're also going to have these professional development webinars from Rural Prep on an annual cycle, most typically in July, December, May, and subsequently in June. So watch for those dates, typically the last week of the month with some exceptions. And again, you'll find that on our website posted and upcoming. We certainly want to value your participation. Thank you for that, but also ask if you would please give us some feedback in particular regarding today's webinar. And with that, Davis, I'd like to turn it back over to you to open up for questions and further discussion.
And there you have our contact information for each one of us and our website. And so now it's time for Q&A. One of the things, maybe before we get into that, thinking back to the travel support for disseminating findings of micro-research, we have a larger travel support program where we offer up to $1,000 for people that are doing research, and I use the term researchers very broadly, so that could include, students such as the type that Randy worked with, to present their findings at a regional or national U.S. conference. And those are open to not just students, but also to faculty and others. And so that's a whole other arm of our activity, but we wanted to create that linkage here with the micro-research so that people have a way to do that through this part of our Rural Prep's work as well.
Davis, this is Randy. Can I just make one clarification? So faculty may apply for the travel stipends, but we have limited that to presentations regarding medical education research or rural health professions in primary care research. The students and residents, any research they do is done in the course of their training and education, and as such qualifies as medical education research.
Yes, thank you, Randy. That's correct. And I'm seeing in the chat screen a request to go back to the contact slide. And I don't seem to have control of that right now.
Yeah, we have another question here. That's what kind of loans were given to the poor in Africa and who were these funds awarded to? And I'll bring up that contact slide.
So I guess, are we talking about the microfinance? I'm assuming that we're talking about microfinance, and I don't know a lot of the specifics about that, but there are several organizations who have dedicated themselves to doing these microfinance projects, and not only in Africa, but in other parts of the developing world. And I don't know if Randy or Dave know more about that, but they tend to be, very small amounts of money. I do remember an example. I think, for example, there was a woman in Brazil who got money for a refrigerator and thereby was able to make large quantities of some kind of special food. I don't remember the specifics. And then she could actually sell a lot more. And that resulted in a huge impact in her family's well-being, and they were able to little by little grow their business and buy items for their home and then send kids to school and those sorts of things. And so that's just one example that I remember hearing of a long time ago. But so they typically are, the microfinance loans are typically for little small business opportunities, and just that one little bit of money that people need to be successful or to expand what they're doing. And then, of course, for Microresearch, there were the examples that I shared with you on that one slide in Africa.
Okay, we have a few more questions here. There's one, is the link to the proposal application on the ruralprep.org website right now?
No, it is not. And so this remains a proposal at this point, although it's very, we think it's pretty well refined, and we're open to your input. But once we finalize our proposal, then we need to get HRSA approval from our funder. And once that's done, then we can go live with it. And that's when we would like to notify all the webinar registrants and other people that are on our contact list that, hey, our application is available, and here's all the information about how it works and the requirements, et cetera.
And again, this is David, just hoping that that'll actually be available. We're anticipating in September, with award notices in October for those of you who are possibly planning with contingent teams and being able to operationalize a project this year. And again, by being participants in this webinar, you'll be one of the first to know. And otherwise, we look forward to being able to give you that information for application as soon as it's available.
I might just add a couple things about microfinance and its parallels in this work, and that is that in Bangladesh, where microfinance really got its start, there were poor people who had no capital to start a business, nor did they have any credit, and banks just don't give money to people who don't have credit. So this was a mechanism for supplying seed monies to women, for example, to start family or home businesses. And the reason they could do it, and their default rate was actually much lower than traditional loans, is because they had relationships with these people. They knew who they were, they knew who they gave the money to, and they knew who to go to get, to find out if anything happened with it, and to collect the money if that needed to be done. In the same way, if we can somehow take advantage of the economies of small scale, we hope to be able to do the same thing. The challenge we have is that government funders and universities are very reluctant to give people money before they've actually delivered something, particularly if they're not your employee or they're in a residency program that doesn't have a grants management structure. And so it's very difficult for us to figure out a way to give this money to individuals in those settings without it being very tightly controlled, to avoid giving money to folks who can then turn around and buy a new car. We want to make sure that the funds are used for the purpose of scholarly work, but we don't want to make it so onerous that the expense, the transaction cost of that exceeds the actual amount of money that we give.
We have another question from Sarah. What about those who want to be involved that are not in an undergraduate or graduate program?
Yeah,
I'll take a crack at that, David.
Oh, okay, yeah. I was just going to ask for more information about the types of persons, because we did spend some time thinking about who should be eligible. So if there's more, and if you can provide more information on the types of applicants you're thinking about, that would be helpful for us to consider. But go ahead, Randy, and take a crack at your thinking on this.
Well, the funding for this grant really is directed at rural health professions education and training and research around that. And so in that sense, it limits us. We can't simply fund research projects around age pregnancy in Atlanta, Georgia, because it's a good idea. It's really either research done by learners who are in a structured program, preparing to be a primary care health professional, or projects that are looking at what works best in training. Is it best to have weekly grand rounds, or is it better to have daily teaching rounds for 15 minutes every day? Which is a better strategy? And you can do a research project about that.
I would add that if you're able to link yourself in some way, if you're a community member, for example, that wants to pursue something like this, then to try to see if you can link yourself to either a recipient or a mentor or somebody who would be an appropriate applicant.
And Davis, this is David. I'll just share. I think that's exactly one of the goals of Rural Prep, and particularly along the area of priority given to community engaged micro research. So if you are the community, what a better way to collaborate with other qualifying participants to in fact have a community engaged, community initiated proposal as an applicant team.
Yeah, I like that, Dave, because so often community engagement is framed, because it's an academic term, is often framed in the sense that the university, for example, is reaching out and engaging the community. But in fact, if you're a community member who has a research idea, find a trainee or a learner who shares that passion and do a project with them and engage in it together.
We have another question here from Anthony. Can these grants potentially be used to research a cross-border medical service initiative by university students in the Twin Salts of Michigan and Ontario to study the binational sharing of medical services in remote area of US and Canada?
Well, my preliminary reaction to that would be, so one has to keep in mind that this is U.S. Federal government funding, and that's one reason why, for example, we don't fund people to go to international conferences. But that topic sounds as if it's something that is clearly relevant to U.S. healthcare. So as long as it has a U.S. healthcare component to it, or health professions education component to it for U.S. students, then that seems like a potentially viable topic. And that's something I think we would want to consult for absolute certainty with our funder, but that sounds like a possible viable topic.
And that sounds like an awesome opportunity to get funding from Canada as well as your match, so that you can show that it truly is collaborative work.
Another question here from Breeze. How much funding could be available for microfinance for those wanting to start or expand their small business?
I'll just say that the amounts of money were very small in Bangladesh. I mean, you talk 25, 50 bucks, as well as larger amounts of $500 or more. I think it really depended on where it was being implemented, and microfinance has been implemented around the world. I'm not aware of its flourishing in the United States. It's generally been in developing countries.
If you go to our great Oracle Wikipedia, you can find quite a bit of information about microfinance there. And I was reminded of some of, for example, Mohammed Yunus is somebody who you may have heard of in the Grameen Bank, is one of the institutions that does this. There's also an organization called Kiva and Finca. And there's quite a few models for this. And one thing is that they're often focused on women and encouraging their development and as small business entrepreneurs.
One of the reasons we chose to go this direction is that a lot of rural health professions education and training programs are not associated with a university, and so do not have access to small internal seed grants and such. And we wanted to encourage research in all rural places over the United States, and not just places that are associated with an academic center. Again, looking for the places that would most benefit from a small amount of money.
And then we have another question. Is it being microfinance funding for small businesses?
I'm sorry?
We may need, Breeze has a few different questions, so maybe you could follow up with an email about the specifics of what you need to know, Breeze.
And this is David. I might be able to rephrase if I have it correctly. I think the question being asked is, will the microfinance funding for small businesses be offered in the United States through Rural Prep?
No.
I see. No, our focus, so microfinance was sort of the inspiration for micro research, and we're research institutions, so we're not, our focus isn't in funding small business. It's trying to get research on rural primary care health professions, education and training, and as well as rural population health is something that we're interested in as well. So our focus really is research, but microfinance, we talked about that because that has been the inspiration for what the Canadians at Dalhousie University did with universities in Africa and their students. And so, and they in turn are our inspiration, but it's sort of an analogous concept that we wanted to introduce. Microfinance versus micro research, which is our focus.
There's a few more here. Would public health graduate students be eligible?
I would think so. Yeah, that's a good question. And I think I would say any, public health is part of, it's not the same as healthcare providers. And, there's that sort of traditional divide between public health and healthcare. And I think certainly in today's world and with health reform and greater population health focus, I think we want to think broadly about public health students are health professionals as well, and so that would be my, without having discussed this with Randy and Dave, that would be my initial reaction to that.
Well, yeah, I would recommend that if someone who, for example, is a public health student wants to do a project, that they engage with a primary care health professional student and do this together. That would be my recommendation, because then it would clearly fall within the scope and the eligibility of the project.
Yeah, that's true. And I would say, and by the way, if 2 or more students team up in that way, we would consider, offering up to 2 $4,000 award amounts. So each student would be able to do that, but in a collaborative project. And yes, we are about primary care, and increasingly primary care is being called on to think about population health and public health. And so I agree with Randy on that point.
We have another question here from Darren Bell. It sounds like this is designed to be a learner or student or resident driven rather than faculty driven. Is this correct? And then, for example, the awards would be given to learners only and faculty would serve as research mentors, or will the awards be given to learners or faculty?
Yeah, it's meant to be for learners. The way that faculty become involved is as a mentor. And I will add this clarification that if someone has a local mentor who may not have the expertise, say, in qualitative research, then Rural Prep hopes to pair you as a team with a mentor who does have that expertise. So the point is to pair you with people who can help you through the project. So, for example, a faculty person with a resident and an external mentor with expertise in a certain area would make a great team.
A related question to the previous question that was answered, could graduate students in clinical psychology be eligible, particularly if they are interested in integrated behavioral health, interprofessional education, and collaboration with physicians?
Again,
yeah. I think, again, this would be a good one where, especially if it is an interprofessional proposal and you are talking about primary care physicians, NPs, PAs, et cetera, that are trying to integrate behavioral health. We actually have one of our, I mentioned earlier on that Rural Prep itself, we conduct 2 research projects per year. And one of our projects is on that very topic. It's looking at telepsychiatric consultation in rural primary care practices. And so that would fall very much in line with the notion that, the primary care team isn't just the physician or the NP or the PA, et cetera. It does include other members of the team, but we would want that connection to the primary care clinician to be explicit.
Yeah, so a clinical psychologist could pair up with a nurse practitioner student to do a study in integrated behavioral health. And the funding doesn't pay for either person's time. It's for materials, for software, for perhaps even payment for participation to research subjects. We haven't cleared that hurdle yet. But the project itself, if it's interprofessional, you get extra points for that. The primary care health profession student would be the awardee in that case.
It looks like that may be all the questions. I'm going to go ahead and post the link to the survey. We ask that you provide some feedback for this. And this was recorded, so you'll be able to access this both on the website and on the Rural Prep YouTube channel. And unless anyone else has anything, Davis, Randy, or Dave? I believe.
Well, I just would like to thank everybody for dialing in and staying with us, and I hope that you will be checking back with us as we hopefully roll this out as a final application available on our website in the near future. So thank you all for participating.
And we also look forward to having you participate in our future webinars as well. So stay posted. Thank you for your engagement. We look forward to continuing the mission of Rural Prep.
Absolutely.
Okay, thank you.